This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome to the latest Best Health Podcast, brought to you by Wake Forest Baptist Health. I'm Justin Gomez with Wake Forest Baptist. I know I say I do a lot of these, and I say we have special guests a lot of the time, and we do. But today we do indeed have a very special guest. Dr. Julie Freischlag, the CEO of Wake Forest Baptist Health and the Dean of the Wake Forest School of Medicine, is joining us today. So welcome, Dr. Freischlag.
Thank you so much for taking time to talk with me.
Absolutely. We appreciate your time. We know you are extremely busy during this time with the COVID-19 pandemic affecting the world and certainly this part of the world that we're in as well. Today, I think we're going to have a really good conversation, and I'm excited to have Dr. Julie speak to this topic because we've been getting so many social media messages and emails about just how people are appreciative of healthcare workers right now and being on the front line, and several people have reached out about ways to help out and asking what they can do. So we're hoping that this podcast will shed some light on answering some of those questions. But before we get started, I do just want to let people know, like I'm doing at the beginning of all of our COVID-19 related podcasts, that if anyone just wants any overall information about Wake Forest Baptist Health, clinic information, visitor restrictions, FAQs, CDC recommendations, we have a lot of great information on our wakehealth.edu/coronavirus website. All kinds of really reliable resources on there. And if someone has questions and they feel like they need to talk to someone over the phone, they can access our COVID-19 hotline at Wake Forest Baptist, and that's 336-70-COVID. And that is manned 24/7. So we're able to answer any questions that someone might have that's listening, one of our patients or what have you. So I want to let people know that at the top of this podcast. But now I want to really get into the meat of the topic and just, Dr. Julie, before we get really diving into the specifics, if you could just give a real brief overview, just a little bit of background about who you are and how long you've been here at Wake Forest Baptist Health.
Sure. So I've been here 3 years almost come this April, and I've served initially as CEO of the health system, and we've grown quite a bit since I've been here. We've added Wilkes Medical Center as well as High Point Medical Center, and so we actually are a 5-hospital system with a large network of physicians as well, along with a medical school for medical students, PA students, and nurse anesthetist students, and I also became dean the first year I was here. So I am a vascular surgeon. I actually operated on someone just last week who had an issue with her hand that was acute and urgent, where she was throwing clots down to her hand. So we are still doing some urgent emergent surgery, but as of the 18th of March, we stopped doing elective surgery so that we can have capacity to take care of patients who have COVID-19.
Sure, that makes a lot of sense. So, just to start off with, as broad strokes, speaking, you've been in the healthcare industry for many, many, many years. And, I know that your career has taken you all over the country into some other really great academic learning centers, medical centers. Just in all your years being in the healthcare industry and caring for people, how does this time now compare to what you've seen with other times in your career? Have you seen anything quite like this before?
No, it's actually pretty unprecedented. When I was out on the West Coast at UC Davis, we did have the Ebola event, but very few patients ended up in the United States with Ebola. We screened a few, but that actually turned out to be a small number of patients that came over from Africa with that. We've talked about pandemics, but we have not had to manage one, especially as extensive as this one has been over the entire world. And as all of us have seen, it's different in each state. Our larger cities, such as New York and Boston, now Detroit, Los Angeles, and certainly starting off with Washington State had lots of patients. We're screening more patients. We haven't screened a lot of patients in North Carolina. We're seeing an increased incidence. But for our hospitals, we just have a handful of patients in 3 of our hospitals at the present time. But we have not seen the surge yet. We expect to see more patients over the next 7 to 10 days. So no one really has experience in this, and that's why it's so important that we listen to many of the mandates coming out of the CDC. We have to keep all our patients safe, so that's sort of why we've had to stop elective surgery, limit the number of visitors coming in to our hospital, making sure that only sick people are coming into clinics. We're doing a lot of our clinic visits virtually. I just saw my patient virtually right before this podcast to let her go home after her surgery. And then we need to keep our caregivers safe as well, too. So our caregivers are right at the front line taking care of patients, and that's important. And as you know, we need a lot of personal protective equipment for our patients as well as our employees and our staff and our physicians. And we have had some incredible donations as well as been able to get enough protective equipment. As of today, we have a weekly or daily report out on that. But that actually has been great in our community as well.
Okay. Well, just speaking to, I know the leadership at Wake Forest Baptist Health takes this very seriously, and we're blessed with the people that we have within our organization. From what I've seen, being here a couple of years as a part of Wake Forest Baptist, and I'm sure you've seen as well. So if you just want to speak to real quick, just kind of the planning and preparedness that the leadership puts into scenarios where we're able to implement these types of policies and procedures when should the time arise, such as now. I know that y'all spend a lot of time kind of talking through and planning for incidents that could happen, such as this.
Yeah, we have some real experts. As you've seen, Dr. Christopher Ohl has been on Facebook as well as on radio, TV. He actually is our expert in this and is actually guiding us of how to deal with our patients as well as our staff. We did open our command center about 2 weeks ago. We've used that in the past for bad weather and other issues going on in the region, but now we have reports out twice a day from the command center, really looking at the number of patients in hospital, number of patients outpatient who have COVID-19, how our staffing is doing, any issues going on locally, regionally, and throughout the state. We have spoken also to the Secretary of Health, Dr. Cohen, as well as the governor, and all the CEOs also have weekly meetings so we can talk about what's going on in other parts of our state. So this is new to us, this coronavirus 19, but we do have abilities to communicate, talk with each other, making sure that we understand what's important, and then having each one of our leaders take those messages to all 20,000 of the people that work for Wake Forest Baptist Health.
I know being an academic medical center, people don't realize sometimes about how much the research arm is a core mission, piece of our mission. That we do day in and day out, and how that directly leads to increased or improved care at the bedside. Can you speak to that for a second?
Yeah, and actually, we need extra money to do all our research. We get money from the NIH as well as the Department of Defense and many other places, but in order to maintain new ideas and to go out and investigate new things, sometimes we need startup funds to make that happen. We are looking at ways to treat COVID-19 through our regenerative cures under Dr. Atala's lab. We also are putting our names in to do some clinical trials with COVID-19 for treatment and prevention. So all of that together can be helpful, but we also do research on cancer and diabetes and heart disease, as well as Alzheimer's and other neurological diseases and aging. And so all of those things are out there if you want to support them during this time where we really are consumed with the COVID-19 virus and unable to do the full spectrum of research we'd like to do.
I do want to offer some other information. Just if people have questions about, they maybe have some supplies that they would like to donate, or have questions about where they can drop the supplies off, or specifically what type of materials we're accepting, whether it be gloves or hand sanitizer or mask or any other sort of donation. People can email COVID-19 support at wakehealth.edu. I'll say that again, COVID-19 support at wakehealth.edu. And we actually have several drop-off locations within our health system. If people are looking to actually drop off donations here locally, of course they can be shipped, and that shipping address is on the How You Can Help website. But people can donate locally at Piedmont Plaza 1 building here in Winston-Salem for the main campus. It's close to the main campus at 1920 West 1st Street. There's a donation container at the loading dock at Davie Medical Center, at High Point Medical Center, at Lexington Medical Center down in Lexington, and at Wilkes Medical Center as well. So really people throughout our whole care area, wherever Wake Forest Baptist Health is serving patients, they can respond and go to their local medical center to drop off some donations. So we appreciate, like I said, everyone that has reached out so far. And, those are for physical donations, but, and I'm sure Dr. Julie can reiterate this, but what is really helpful to help continue the mission of Wake Forest Baptist Health with kind of our three columns that we focus on, with clinical care, with education, and with research is a financial donation. And Dr. Julie has spoken to this and just the impact. And Dr. Julie's been around healthcare for years and years, and she's just seen just the impact you can have on a student, or making a donation such as this that goes to this response fund, how that can have a direct impact on the frontline healthcare workers, and how that can, if they feel like they're being supported through whatever means possible, if it's a physical item donation or financial donation or food, or even cards, thank you cards. I've seen some of those posts on social media as well. It just goes to lift the morale of the frontline workers, the doctors and the nurses, doesn't it, Dr. Julie?
Yes, it does. It's just amazing how that gratitude and that thanks really goes a long way, because that's why we're in the business. It's to take care of people, and the appreciation is just so heartfelt.
We're so appreciative, and I know you're appreciative as well, Dr. Julie. If you just want to speak to just how grateful we are, and we're going to wrap up here in a second, and I'll give the website information one more time. But if we can just speak of just how grateful we are for people considering us for their donations, that would be great.
Great. And again, I thank you for the past and into the future. And then in the time of crisis, we know you're all there with you. We have great communities, not only in Winston-Salem, but also around High Point and Wilkes and Lexington and Davie. So whatever hospital or group that you would like to support, we would be forever thankful. Again, thanks so much.
All right. So in addition to Dr. Julie Freischlag, we also have another very special guest who has, she's spent long hours as well with the COVID-19 response and with our leadership team, and making sure that our organization has all the resources coming in that we can possibly have coming in. And that is Lisa Marshall. And Lisa Marshall is our Chief Philanthropy Officer for Wake Forest Baptist Health. So welcome, Lisa.
Thank you, Justin. Great to be with you today.
Well, appreciate all the hard work you're doing, and we're going to get into a couple of the details here about how people can support Wake Forest Baptist if they feel like they can.
Terrific.
you all work, year round. You in the philanthropy and alumni relations department. You're very busy as it is, but obviously these are unique times. So just talk a little bit about how the COVID-19 pandemic is affecting y'all, and how your team is working through this and making the best out of it.
Well, it's really been an experience like it is for everyone. It's amazing at times like this when you have the opportunity to see all of the goodness and compassion that exists in the community.
Yeah.
And we've really seen the communities that we serve rally together in just wonderful ways. And I can't think of a better example than that, than some of the donations that we've received for the personal protective equipment from many of the companies in our community. They have really stepped up and made an effort to ensure that our healthcare providers will have all of the safe equipment they need so that they can truly serve the community in the capacity that we're here to do.
Yeah, that's a great point. So, I know y'all have been, we've had lots of questions coming in from the public, from individuals, and from companies. And I know y'all have been hard at work putting together resources to help answer those questions. Can y'all speak to, what your team is doing specifically to respond to the COVID-19 situation that we're facing?
Absolutely. We started out by quickly putting out our COVID-19 response fund.
Mm-hmm.
And we felt that that was really important to do right away because we had so many people who were reaching out and wondering what they could do for the medical system and for the community. And the beauty of the COVID-19 response fund is that it gives us the flexibility to utilize those funds for the most immediate needs that we have.
Mm-hmm.
And certainly, as I mentioned, the personal protective equipment is one of those areas that we are emphasizing and focusing on.
Mm-hmm.
But there are many other things. We recognize that with everything that's going on right now and the impacts to the economy, there are patients that we're seeing who have immediate needs and they don't have the financial resources. They may have been laid off from their job.
Yeah.
They may be a small business owner who's not been able to keep the company running. So there are a lot of impacts out there, and we're able to flex with these funds and apply them in the ways that have the most immediate positive impact on the community.
That's a great point, Lisa. And that's so true. And I'm glad that y'all have been able to stand up the COVID-19 response fund. And I know people are donating physical items as well, which is fantastic, with the masks or the gloves.
Right.
So, from your perspective, you've been reached out to from companies and individuals, right? So both individuals and companies can make donations, correct?
Yeah, absolutely. I would say that every constituent that we have has really stepped up. The individuals in the community are reaching out. They're utilizing our website, clicking on our How You Can Help button, which takes them right to the page that gives them a lot of information on the ways they can support. Many are choosing to make a cash donation or a credit card donation. That's easy to do on the website. We have others who have indicated their desire to make homemade masks.
Yeah.
And we do have some instructions out on the website for different ways to do that.
Okay.
And those donations can be dropped off right at our locations around the system so that it's easy for people to do that. And while those masks are not being used with our employees at this point, they really can serve a purpose for patients, for visitors, even though we are minimizing the number of visitors on site because of the concerns for their health.
Sure. So, in from your perspective, in working with donors for years and years, like you have, you've seen just the rewarding nature of your work and how people that have the ability to can have a direct impact on the front lines. Can you speak to just for a moment how someone does participate in the COVID-19 response fund or donating items, just how you think that that would impact, our organization and the frontline workers directly?
Yeah, Justin, I think the thing that always strikes me is the incredible impact it has on the anxiety and the stress level that our care providers feel.
Yeah.
They truly are on the front lines. They are the superheroes of this pandemic.
Yeah.
And that's a big load to carry.
Yeah.
But when you know that people are out there supporting you and that they may not know you personally, but they're thinking about you, they're caring for you, and they're making a contribution in your name because they know you're there working hard. That makes a big difference. And we're doing everything we can to share many of those comments that come in with the gifts,
okay,
and get those pushed out to our employees so that they're aware of them,
yeah,
and they get to have that kind of moment of really feeling embraced and supported in everything they are doing. So along with making a donation, we really hope that people will put in a comment about why they're doing it, what's motivated them.
Yeah.
We've had just some wonderful, wonderful comments that have been shared. We're always very interested in what areas the donor is interested in focusing on. And so that's an important piece of any gift that comes in. But in this case, what we're doing with the COVID-19 fund is really applying to those best and highest use, the most immediate needs.
Yeah.
And that's where, we hope that people out there will recognize that the needs are coming at us that quickly, that from one day to the next, the need may be very different.
Mm-hmm.
And so we're really trying to be very fluid with that. But again, we're always interested in what the donor is focused on and what concerns they have. So our job is really to try and marry those two things, what their interest is and what the actual needs are.
And I do have another question, and you've probably gotten this, I guess, on a more macro, higher level before, in the years that you've been working on our behalf in philanthropy. But there's a lot of great charities out there, and sometimes, maybe someone might ask, well, if this hospital has XYZ revenue coming in, do they need philanthropic support, or why would they need that? And I think you might be able to answer that better, possibly now than we ever have before, just with the healthcare workers being thrust into the front line to battle this pandemic. But if you want to speak to that, I think that would be helpful for listeners to hear.
Sure. I would share a couple of things. I would say that, first of all, it's important to recognize that there are many nonprofit hospitals and healthcare systems across the country,
Mm-hmm.
and all of us share a mission to do whatever needs to be done in our communities to improve health and protect health.
Yeah.
And certainly in the COVID-19 scenario, we're very much in the protect health mode. And we will do whatever is needed in our communities to ensure that as many people as possible can stay healthy, and that those who do become ill get treated promptly and treated well.
Yeah.
So that's a big mission. And it's important to recognize that we have nonprofit status and we need the community support, because the reimbursements that come for providing that care often do not cover the entire cost.
Sure. Yeah.
And that's where the challenge resides in healthcare. So that's from a clinical care perspective. That's why having donations and community support is so critical. And in our particular case, because we are also an academic medical center, we have 2 additional missions on top of providing the very best care.
Mm-hmm.
So we also have our research mission, which is to ensure that things like a vaccine someday for the COVID-19 will exist.
Yeah.
That's part of our mission. The other piece is to educate the next generation of healthcare providers. And so both of those missions require investment and support. And again, that's exactly where the community and our donors come into play, because they make that possible.
I do want to remind people of the wakehealth.edu/COVID-19 support website, wakehealth.edu/COVID-19 support. Teamwork comes to my mind, Lisa. We're all in this together, right? And it's gonna take the village to battle this pandemic and to help defeat it, right?
That's exactly right. This is the time when we demonstrate what we mean when we say community.
Yeah.
And we are in it together. We are here for each other. And there are a lot of ways to demonstrate that you're in it and that you're part of the community. And that's really what we're asking is take a look at our website, think about what's important to you, and we're quite sure there's a way you can participate.
So we appreciate your time, Lisa.
Thank you very much, Justin, and thanks to our many, many community partners out there.
Yeah, so Lisa Marshall, Dr. Julie Freischlag, our guest today on this special Best Health podcast learning, just helping get the word out about how people can participate and join the fight to defeat this COVID-19 crisis that we're in. So I appreciate their time and look forward to talking to them again in the future. Until the next episode, I want to thank all the listeners for taking a listen to this podcast and all our other podcasts. And until we talk again, please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.